We've talked about the random drug testing of welfare recipients in the United States before. There's a strain of right wingers that like the idea of testing welfare recipients for drug use, with the idea that if someone receiving welfare benefits is on drugs, then they should have their welfare benefits cut either partially or completely in some cases. And the Australian government now is going to do a 2-year test of randomly testing 5,000 welfare applicants for drug use. They're going to start this program in January. And this would require these 5,000 applicants and eventual recipients of Australian welfare to do random saliva, urine, or hair drug tests. And the tests would be for a variety of drugs. It includes meth, MDMA, which is the key component in ecstasy, marijuana, heroin, as well as other drugs. What would happen if they test positive? Well, 80% of their welfare benefit money would be moved to what is called a basics card, which can only be used to pay for food, rent, childcare, and other essential items. Presumably, the idea is it would prevent them from being able to take welfare money and use it to buy drugs. If they test positive more than once, they will then be referred to a medical professional for addiction treatment. There are two aspects of this that I want to discuss with you. One is moral and one is more pragmatic. First is the morality, right? To believe that it's moral to drug test welfare recipients and then sanction or reduce their welfare benefits based on a positive drug test result, you sort of by definition have to support the failed war on drugs and the criminalization of drugs. What do I mean by that? Cigarettes and alcohol are legal, right? So you don't hear people saying, well, test welfare recipients for cigarette and alcohol use. And if they test positive, then cut their benefits, because those are legal, regulated substances. So in order to make the moral case that drug use should lead to the removal of welfare benefits or the sanctioning of 80% of those benefits on a basics card or whatever, you have to, at least to some degree, believe in the concept of illicit or illegal drugs and the prosecution of such drugs in some version of a war on drugs context.
Especially because those costs can often be compatible too. I mean, marijuana versus alcohol maybe costs around the same, hard to measure, but it's not like one's significantly more expensive.
Right. You can't make the case that, well, no, the problem with marijuana is it's way more, people spend way more on marijuana than they do on alcohol. No, it's not necessarily true at all. And we've talked about that endlessly, right? And it's pretty difficult to convince people on moral issues. So instead of focusing too much on that, even though obviously the war on drugs has been a major failure, let's talk pragmatically for a moment, fiscally. Since many people who support this type of testing are fiscal conservatives, they don't like the idea of spending welfare money on drug users for financial reasons. 7 states in the US have tried similar programs where there were drug tests of welfare recipients. And the argument is the way you save money is you drug test welfare recipients and then you take away their welfare benefits. So even though the drug test costs something, you're saving way more by not paying drug users welfare benefits. 7 states did this: Arizona, Kansas, Mississippi, Missouri, Oklahoma, Tennessee, and Utah. They piloted programs like these. The results have been completely definitive and unanimous in 2 ways. Number one, write this one down. The drug use rate among welfare recipients has been lower than the drug use rate of the general population. In other words, if you randomly drug test, we'll pick Utah. If you randomly drug test Utah residents, they will have a higher drug use rate than when you randomly drug test Utah welfare recipients. The random residents will use drugs at a higher rate than the welfare recipients. That's interesting. Sort of logical, too. If you're applying for welfare benefits, you presumably have less disposable income. You're less likely to go and spend money on drugs, okay? But number two, as a result of the low drug use rate among welfare recipients and applicants, the cost of the drug testing in these tests has exceeded the savings from kicking the drug users off of welfare. In other words, Missouri spent $336,000 drug testing about 39,000 people. Only 48 people tested positive for drugs, which would not save you the money that the entire drug testing program cost, and similar results around the country. It's bogus.
Well, I mean, specifically when it comes to Australia's pushing for this, right? I mean, at least they're not going to just kick people off of their welfare benefits like they're doing in some U.S. states. I mean, there's this first round where the welfare money that you get has to be allocated towards rent or towards food or what have you, and then the second strike is having to go to some medical health professional to deal with the addiction. So
you're right.
Even in its worst light, Australia ranks better than some U.S. states here.
You're not wrong, but that basics card where 80% of your welfare benefits are transferred, that is part of the sketchy crony capitalism that is often in the background of these ideas. Those basics cards are administered by a company. That is a system that requires infrastructure and implementation. And of course, the company that administers those cards has connections to Australian politicians. Sort of another story, right? Separate from the idea of drug testing welfare recipients. But crony capitalism always in the background.
And correct me if I'm wrong, but Australian politicians are also on the public dollar. So
yes, they are.
Should they not be drug tested as well? I mean, if the idea is we don't want our tax dollars going to people who are going to turn around and spend that money on drugs, maybe cops, bureaucrats, politicians should also be drug tested as well?
Same argument's been made in the United States. I agree, total non-starter. I mean, laughable non-starter. The video you just watched was made possible by support from you. Please go to patreon.com/David Pakman Show. You can make a pledge of as little as $1 per month. And every dollar helps to support the work that we're doing, particularly in light of the YouTube ad boycott, which has been really bad.